us the requirements and then just kept talking about people.
Well, I'll try to keep it.
So many of you know our guest speaker today. We want to thank Ms. Tiffany Smith for joining us during her planning period to talk to us about one of her many responsibilities that she does as an athletic trainer. So if you will welcome her this morning. You are going to be continuing your notes page as she talks. And then she's going to open it up for questions at some point during her presentation. So turn it over to you, Ms. Smith.
Awesome. Good morning. How's everyone doing? Good. Oh, good. Okay, thank you, Landon. Some of you have me in class, so you've kind of already heard this. But I do think it'll go into a little more detail of how to become an athletic trainer. So we'll go ahead and get into it. First of all, how many of you know what athletic training is? Ariana, you better raise your hand. Okay. Can you give an example of what athletic training is?
Possibly, it's kind of just going like over a sport, kind of helping them. You can help them through recovery. You also do little side jobs, like kind of fun, like the water, helping with equipment.
Yeah, for sure. So athletic trainers do specifically work with athletes. So if athletics, if you play sports, if you're really into that, then athletic training might be something that would pique your interest. So what is an athletic trainer? They are a certified and licensed healthcare provider who practices in the field of sports medicine. So it is a healthcare career. You do have to apply for your license and pass a board of certification to become certified, okay? A lot of people get athletic training mixed up with personal training. They are not the same, okay? I have so many people come up to me, hey, like I wanna lose weight, like can you make me an exercise plan? I'm like, I mean, I could, but that's not what athletic trainers are for. They are healthcare. So some duties of an athletic trainer: prevention of injuries and medical conditions, examination of injuries, diagnosis of injuries, treatment of injuries, and the rehab of injuries. So we kind of have a lot that we're juggling. Keep in mind that if you work in the high school setting, you're also doing this for around 200 athletes. Okay, so one of the questions was, is there writing involved? Yes, you have to make notes out of all this, and I put an example in here for you guys. Do you guys need this up longer? Yes, no? Yes? Okay. While some people are finishing notes, what do you think one way that we prevent injuries? What can an athletic trainer do? Think of if you've ever been in Heath's office. Okay, stretching. It's a good one. I do a lot of stretching with athletes. What else? A main one. Before the game, go in the training room. What do you get done? Taping. Yeah. Taping is a huge form of prevention for athletic training, for especially ankle sprains. All right, so personally, my educational background, I did go to Purdue, so those of you who are Tennessee fans and following March Madness, I apologize, but Purdue is going to the Final Four. I got my bachelor's of science focused in athletic training at Purdue. I then went on, has anyone ever heard of a grad assistant position? Because I feel like these are often overlooked. Does anyone know what that is? Okay, so a grad assistant position, you apply for them, and if you get accepted, they pay for your master's degree. Okay, so there's a lot of opportunity in grad assistant positions. So I applied to MTSU and got accepted, and so they paid for my master's of education, which has nothing to do with athletic training. My master's, I know one of the questions is, does it correlate? Mine does not. I randomly got a master's in education because that's what they offered me. And I was like, okay, I'll take a free master's. School is expensive, so if you do get an opportunity to apply for a grad assistantship, I would definitely take full advantage of that. So did my Master of Education in Administration and Supervision, like I said, at MTSU. That's how I originally moved to Tennessee. But I have sad news for any people who are going into athletic training. As of 2022, it did transition to a 6-year degree, okay? Meaning after 4 years, you can no longer sit for your boards. now you have to do an extra 2 years and then you can sit for your boards. So I don't personally like that, but that's what it is now. I'm hoping in the future the salary will reflect that, and we'll get into that a little bit later. All right, so I kind of just touched on this, but how do I become an athletic trainer? First, you'll have to do a 4-year kind of like pre-athletic training degree. So you'll take, you know, all your biology and chemistry, anatomy, and then after you're done with your bachelor's degree, much like physical therapy, physician assistant, then you'll get to apply to an athletic training master's program. Okay, so you'll apply to the master's, hopefully get in somewhere. You'll complete your master's in athletic training. And during your master's, this is when you'll do all your clinical rotations. Okay, do you know what a clinical rotation is? All right, so basically you go different places. Like one of my clinical rotations was physical therapy. So I had to go there, I had to shadow, I had to learn all about it. Another one of mine was Purdue swimming and diving. I also worked with Purdue football. I also worked wrestling. Ugh, did not like that. And then my senior sport was Purdue volleyball, which I absolutely loved. My favorite rotation. It is cool with athletic training because like they private fly everywhere. So we would just like go to campus on a Wednesday for a game in Maryland and fly right from campus. They pay for all your food, all your hotel. They take care of everything. You just fly back, and it was really cool because I got to go to every Big Ten campus to work a game. So that was pretty fun. But once you complete all your education part of it, which is the first 3, then the scary part, you do have to sit for a big scary test called your boards of certification. Okay, if you do not pass your boards of certification, you are not an athletic trainer. So very important to study. I was so stressed studying all the time, but I did pass my first time, thankfully. But if you don't, it's okay. You can retry, you can study more, take the test again. Much like in nursing, have you ever heard of the NCLEX? Okay, it's the big test you have to take after your 4 years of nursing to become a nurse. Same thing for athletic training, we just call it the boards of certification. Once you're certified, then you can apply for your license. Okay, so you can't practice athletic training without your certification and license. And licensing is different in every state. So if you move states, you got to reapply for your license. Okay, you don't have to retake the test, but you do have to go through the whole licensing application again. Any questions so far? No? Am I talking too fast? Yeah.
If I fail the boards, how long do I have to wait to take it again?
It is, I think it just changed, but when I was in school, it was 60 days. So there is like a small waiting period that until you have to retake it, but that just gives you more time to study and prepare for the next time.
And how many times are you allowed to attempt it?
Unlimited.
Like,
Yeah. Yep. So is nursing. You can take it as many times as you want, the NCLEX. So, good question, Miss Holt. Thank you. Anything else so far? I feel like I'm throwing a lot at you. You good?
What was your favorite Big Ten school to visit?
Ooh, that's a good question. I would probably say either the Penn State football. I traveled with football. The crowd was like really cool that day. So I like the Penn State football game. And then Nebraska is like huge on women's volleyball. And so their crowd was insane. So that was another cool one to go to. Anyone else? All right, one of the questions, how much writing do we have to do? I know this is an English class, so you guys probably write a lot in here. How many of you hate writing? Oh, good. Okay, maybe a couple, that's okay. How many of you really like it? Okay, you guys are very active today. So you do have to do quite a bit of writing in athletic training, mostly just your medical documentation. And if you're in my class, or if you took my rehab class, we write SOAP notes, okay? So a SOAP note is how we document all of the findings from an exam. It is important to be very thorough when documenting because let's say you document something and then someone sues you, okay? Your documentation is your backup to protect you. Be like, no, I documented this, like it's right here. So a lot of times, or let's say you had a really busy day, you forgot to document. Someone sues you, you can't go back, okay? So you gotta make sure you keep up with your medical documentation because you're protecting yourself by doing that. Document everything. Even if it seems like, is this important? Just jot it down, okay? Put it in there just in case. So this is an example of a SOAP note.
All clear, all clear.
Yay. We call it SOAP because it has 4 sections. So it has a subjective section, and in this section, you're just trying to collect as much information you can from your patient. Their age, how did this happen? What is your pain like? Anything you can think of. Has this happened before? Have you had surgery on this? You want to collect everything you can in your subjective part of your SOAP note. Your objective is things that you measure. Okay, so this won't make much sense to you guys, but the range of motion, your swelling, you'll do special tests and you'll document them all here. The A is your assessment. So this is kind of like, okay, I think this person has a grade 3 ACL sprain. Okay, so that's an ACL rupture. So that would be your assessment, kind of your diagnosis of your patient. And then your plan is, all right, now we did this exam, we got this result, what are we gonna do with the patient? Are we gonna send them to physical therapy? Are we gonna send them to surgery? What are we gonna do? Okay. Any questions about SOAP notes? Okay. A lot of people now have like electronic SOAP notes, so it's kind of like, it's actually probably less writing now because you can like click through and like there'll be drop down menus to like automatically do your SOAP notes for you. But back in my day, I've always handwritten them. I like to have them with me or where I know they are. So, all right, reading. Honestly, there's not. Once you become an athletic trainer, unless you're like researching like an injury that you're not super familiar with or like maybe a new treatment you want to try, there's not a ton of reading with athletic training. In college there is, but I feel like in any like career, you're gonna read a lot in college anyways. So, communication, very, very important with athletic training. Important to be able to professionally communicate with your athletes so they know what's going on. Also your parents, especially if you work in the high school setting, you're working with minors for the most part. So not only do you have to communicate with your athletes, but you also need to loop their parents in. Coaches, and then any other members of the athlete's care team, okay? So I did a little example down here. Clearly communicate expected return to play dates and timelines with coaches. I think like my first year as an athletic trainer, there was a miscommunication between me and my football coach. It was our starting quarterback. He was out with an injury. My coach thought he was coming back for that Friday's game, but I was not releasing him, and so he made his whole plan about the quarterback being able to play that week, and it came to game day, and I'm like, no, coach, like, he's out this week, and it was like a whole thing. So that was my bad, first year mistakes, or maybe it was his bad, because maybe he didn't listen. No, I'm just kidding. But just, it is important to clearly communicate with everyone in the athlete's care team, including the coaches. All right, a typical day. This one was hard because there's so many different settings you can work in with athletic training. I listed a few here. You could be a high school athletic trainer. You could work in college. You could do industry. Like, okay, you guys know Nissan? They hire an athletic trainer to help their workers safely return back to work after an injury. So big companies are starting to also employ athletic trainers to help with that. My friend works in the industrial setting. She loves it. She's like, there's nothing ever crazy that happens. Like, you're not running out on the football field and have like a dislocated tibia. She's like, it's pretty easy. So she likes that. I don't know if I would. I might get a little bored. I like the excitement of like running out on the field. Yeah.
Until someone's hand is the glove.
Yeah. If you work at an industry setting with heavy machinery, you could potentially get called to some trauma like that. Yeah, that would not be good. And then another one is the clinic. So I actually worked a year and a half in a clinic. It was an orthopedic and sports medicine clinic. So if you're working in the clinic, you're working a typical like 8 to 4 job. Essentially, if you're working in a clinic, you're just helping the physicians get the patients in, take their history and that kind of thing. I like the clinic, but it's a lot of paperwork, like tons of paperwork. So I gave an example for high school because that's where I worked for the majority of my time when I was athletic training. The really cool thing that I think you guys will like if you like to sleep in is you don't have to get there till 2:30, okay? Because during the day for high school, they're in school. And so there's no need for you to be there. So you kind of get your morning to do whatever you want to do, and then you'll report to the school at 2:30. I would kind of just get ready for practice and get my tape set up for taping. And then we do pre-practice rehab and taping right after school when y'all get out of school. Anywhere from like 3:45 to 6:30, you're covering practices. But let's say football's practicing, soccer's practicing, and baseball's practicing. Where do I go?
The one that brings in the most money.
The one that, probably. But I mean, in this case, you said football. That would be correct. Why am I going to football?
More likely to have injuries.
Yeah, it's an impact sport, okay? So we're more likely to have injuries. So you always, that is one hard thing about athletic training is there's always more than one thing going on. So you have to prioritize your time and know where you need to be. Sometimes you'll be out on the football field with an injury and you'll be getting a phone call from baseball and softball at the same time, and you're like, I'm coming, I promise, like I will be there. But that is kind of hard. There's one of you, hundreds of athletes, so you have to make sure you're on it. After practice, we'll do post-practice treatment, which is, you know, icing, cold tubs. We could do a rehab program for them if they're dealing with maybe like an ankle sprain, trying to get stronger. Really anything falls under that post-practice treatment time. However, this looks good, right? 2:30 to 7, easy money. On game days, like Fridays, I would be there till like 11 because we got football on Friday nights. So I'm getting there at 2:30. I'm not leaving till 11. And then I have to be back Saturday at 6 a.m. for treatment. Okay, so the hours are just kind of weird sometimes. Any questions about this one? Okay. Okay, are the hours flexible? No. You're never on your own schedule. And usually it's okay. But if the coach is like, we're practicing 6 a.m. Monday through Friday, well, guess who else is there? You are, the athletic trainer, even if you really don't want to be. I think this is one of my least favorite things about athletic training. Like there were some times when, let's say like I had a trip home to visit my family, and we were supposed to have a baseball game on Thursday night. I was going to leave Friday to go see my family. Then it rains Thursday, and the baseball game gets moved to Saturday. Okay, well guess what? I'm not going home anymore, and I'm covering that baseball game. So it's kind of unfortunate that a lot of your schedule is out of your control. All right, most challenging part, definitely seeing an athlete with a career-ending injury. That's never fun to see. They're usually pretty devastated. And there's not much you can say to them, especially like, let's say they're planning on playing in college and now they get hurt in high school and they're no longer able to fulfill their dream to play in college. That's really sad. I don't like that. Like I said before, the evening and weekend hours, I don't love. And then for the high school setting, managing 200 plus athletes and making sure they receive the medical care they deserve. I mean, if you think about healthcare in general, I can't really think of another career that you have this big of a caseload all at one time. So you have so many people needing you. That sometimes I would kind of feel a little defeated, like, oh, am I enough to help all these people? Because there's so many of them. Now, if you work college, you get assigned a sport. So like if you were Purdue's volleyball athletic trainer, you would only work with the volleyball athletes. So Ariana, if you were MTSU's women's soccer athletic trainer, you would only work with the women's soccer team. So that's definitely more manageable. And then I did want to touch on compensation versus education, because I feel like it's important to share these numbers here. Now that athletic training has switched to a 6-year degree, it really frustrates me with the salary versus other 6-year health careers. So for example, athletic training, the average salary in Tennessee for a 6-year degree is $55,000. Okay. Now, athletic training is weird because the salary can be all over the place. Like if you're a head athletic trainer in college, you're probably making 6 figures. But average, $55,000. If you're working in Rutherford County at a high school, you're probably making around 60 to 70. Okay. But a nurse practitioner, same amount of schooling, is $114,000 a year. Okay, that's double athletic training, which is very frustrating to me. Physician assistant, 6-year degree, $110,000 a year. So I just like to point that out. I wish someone would have pointed that out to me when I was your age. So I just like to throw these numbers up here. If you are interested in healthcare, make sure you do your homework on this kind of stuff. But I never want to deter you from doing what you love and what you're passionate about. And so I always tell all my health science kids, passion over paycheck, okay? This is something you're going to do for the majority of your life. So if you are passionate and love sports, love athletic training, love the body and helping people, then athletic training, you'll love it. You really will. I love athletic training, those aspects of it. I don't love this necessarily. Yeah.
I'm only going to go out to school for 2 years to be a paramedic, and that's what I'm going to be making.
Exactly. Yeah, that's a good point. There's a lot of 2-year degrees, associate's degrees in healthcare that make more than this 6-year athletic training degree. A sonographer, you guys know what that is? You know, ultrasound tech, like when you're pregnant, you go in and get to see the baby. They make, I think it's like $73,000 a year, and it's like a 2 to 3 year degree. So just do your homework, look up, and I can always help you too. If you are sitting in here or listening and you are interested in healthcare and you're like, I just don't know which way I want to go, come talk to me before the end of the year and I can definitely help you guys. All right, most rewarding part of athletic training, 100% watching an athlete return to play after a major injury. There's just nothing quite like it. You know, you go through the whole process with them, the devastation of the ACL tear or the Achilles rupture and making a plan to progress and then finally seeing them on the field. It's just really special. I would also say working daily with athletes and seeing their progress in general. I had the greatest relationship with my athletes and they made my job so much fun. It really was so much fun when I was doing it full time. And then days where there are no injuries, the sun is shining, the sky is blue, you're sitting out at practice or you're watching a game and you're getting paid, okay? That does happen. There's a lot of times I would just show up to work, no one needs me. I'm just enjoying the day and I'm getting a paycheck. Okay, and then the next day it's like raining and 30 degrees and I have a line out the door and every sport is calling me. So it's just kind of hit or miss, but it is a lot of fun. I'll tell you this, you'll never be bored. You will always be doing something and working on something or watching something. So it is a lot of fun. And I think that's all I have. So questions? Yes.
How much of athletic training will translate to nursing if you were to switch careers?
Funny you should ask that because I am switching careers. Yeah, so I'm switching to nursing. I start a program in August. And so because I have my athletic training degree, I'm able to get a second bachelor's degree in nursing in just 15 months, where a normal bachelor's of nursing is 4 years. So you might be like, why are you leaving athletic training? It just doesn't fit what I'm doing in my life right now, you know, trying to have kids and I have a husband. I don't really want to be gone evenings and weekends, But I feel very thankful that I have my athletic training degree because now I can go and do this accelerated nursing program in just 15 months. Of course, your anatomy classes, your chemistry classes, your biology classes, they're the same, nursing and athletic training. So compared to the other people in my cohort, I'm very ahead of them medically because I did athletic training. Yeah.
What is the worst injury you've seen?
That's a good one. I would say I had an open tib-fib fracture. So open meaning through the skin, so I could see the bones. And it was completely displaced. So the bottom of their leg was like a 90-degree angle and their bone was sticking out. I would say that's my most gnarly injury, like it was just gross. But honestly, my injuries that I really don't like are anything to do with the spine. Anytime I have to C-spine someone and worry about paralysis or nerve damage, that's always very scary. So.
Pretty safe to say that one was career ender?
No. Honestly, I don't know because that particular athlete, he stopped playing. Bones heal very easily. So you can definitely come back after that one. But he transferred schools, so I don't know if he did. Football. Yeah. I say usually football, but there's some gross ones, really in any sport.
What was your least favorite event to work?
Wrestling. 100. Are there any wrestlers in here? Okay, good. So you won't get too mad at me. I do not like wrestling. And the main reason is I feel like most of the time for wrestling, I'm just cleaning up bloody noses. This is a really gross story, but it was kind of during COVID time. I was working a wrestling tournament and I was fixing someone's bloody nose because with wrestling, you only get like a certain amount of time for blood timeouts. So you have to do everything really quickly. So I'm fixing his nose, the time's running out and he sneezes and a bloody right here on my chest. And I was like, nope, I'm done. Never worked wrestling again since that. It was disgusting. So, yeah.
I know that in the school system, there are some people who teach like you do during the day and athletic train. What do you think about that, and do you think it's too much?
Yes, I did that for 2 years. So I would teach all day and directly go to sports at night. I was working 70 to 80 hours a week. It was definitely a grind. I don't think it's too much if that's all you have. So if you have a family and stuff, I think those hours are just not attainable. Like it's just, you just don't have enough time in the day to do everything. However, when I did it, I was single. I didn't really have any other responsibilities. The cool thing about it is you do get a paycheck for teaching and a whole separate paycheck for athletic training. So the money is good if you do both, but you'll have no life, pretty much. It's doable. I know someone who's been doing it for 10 years and I'm like, I personally couldn't, but you could. And that's another thing, how I kind of got like into teaching. Because I never thought I could teach, but there are ways you can get into teaching. I mean, all you can teach is the medical pathway. So if you become an athletic trainer and you're like, these hours, you know, this is just not it, you can always switch to the clinic or switch to industry or come teach. So that's always an option that you have. And I love teaching, I do. So it's been a blessing. What else?
What's the longest event you had to work, and what sport or was it?
Good question. Band. I worked a band tournament. Yeah, I know. They hire athletic trainers for everything now. So right now I PRN. Do you guys know what that means? No. So who in here knows what the abbreviation PRN means from medical? As needed. Did you say that? No. Oh, you did? Okay. Yeah, so PRN is as needed. So right now while I'm teaching, I PRN for the whole county. So like Blackman could call me and be like, hey, do you want to work this soccer tournament? And I can say yes or no. I don't have to work any certain amount of hours. So if I'm just like, ooh, I want a new pair of shoes, I want some extra money, I'll pick up a few games and make some extra money. What? Treason, yeah, I work for other schools, I'm sorry. But Stewart's Creek has a band tournament every year, and they hire an athletic trainer, and they've kind of just know to come to me now because it's easy money. I mean, I think I had like one sprained ankle, but I was there from like 7 a.m. I think the last thing that got over, I think I left around 10:40 p.m. So it was a long day, very long, but easy money. Yeah.
What is the most dangerous sport you can?
I would say either football or wrestling. There's a lot of dislocations in wrestling. So, but football, I mean, of course, because you have all that impact, and you worry about head injuries and stuff. So, anything else? All right. Thanks for.
One more.
Oh yeah.
So, is all athletic training based on salary, or is some of it like an hourly pay?
Good question. Yeah. My PRN stuff is hourly, which is why I like to do PRN, because I feel like I'm compensated for the time I'm there. So any PRN you do, athletic training, you'll just get paid by how many hours you work. Yeah. And PRN work does pay better than salary, in my opinion. Like, they usually, like PRN, they need you so much that they're willing to like make it kind of competitive pay. So, all right, thanks guys.